Hi, my name is Steve, and I will be doing my presentation for evidence-based practice. The title of my project is Confused: Improving Confusion Assessment in Hospitalized Adults. And my PICO topic is would proper nurse education in identifying patients at risk for delirium with the use of a confusion assessment method, which is known as the CAM tool, improve nurse understanding of on the delirium and potentially achieve improved outcomes that are related to the adults that are in the hospital. And the reason why I had chose this topic is because I currently work as a post as a post surgery nurse at the local hospital, where we see a lot of patients of the elderly population that comes in for surgery, such as they have fallen and they need to get their hip replaced or a knee done, and that many nurses have voiced the frustration of having to take care of a confused patient, but but uh, but many nurses struggle to tell the difference between the confusion or the delirium and the proper interventions to use. And some of the objectives that I hope that people will get from this project is that they will be able to define the post-op delirium, will be able to suggest the proper interventions for those patients that are at risk. And I also want to input some terminology for common words such as confusion, the dementia, and the delirium. Confusion is more of a short term, the inability to think as clearly or as quickly as you normally would. The dementia is a part of the loss of brain function that occurs with certain diseases, and especially as people age and get older, and that the delirium is a condition that features rapidly changing mental states. It causes confusion and changes in behavior, and it can also affect a person's consciousness, and there may be problems with their attention and their awareness, and they're able to think. So the main focus of my project is the use of the confusion assessment method, which is known as the CAM, and this is a tool that will enable nurses who don't have a psych background to be able to identify and recognize the signs of delirium quickly and accurately in both the clinical and the research setting. The CAM includes 4 features found to have the greatest ability to distinguish delirium from other types of the cognitive impairment, which is what I had discussed earlier, which is the confusion, the dementia, and the delirium. And this right here is the confusion assessment method, the instrument that they use. And what it is that they basically look at the person's ability to reason and think, and they will rate it along these guidelines, and that they will also compare it to the features which are down at the bottom. And in order for the diagnosis of delirium by CAM, it requires the presence of features 1 and 2 and either 3 or 4 to make a positive case of the delirium in a patient. And I also attach a daily delirium assessment and a post-op physician order sheet And this can include various things for the interventions. There are the physician orders for labs. There are the consults to the various other specialties, such as the case management for other arrangements for if the patient should need it, maybe some physical therapy or maybe a nutrition or psych consult. And that we also have interventions for those that are at risk for falling, to maybe remove their Foley, to decrease any other issues or confusion. And on that, we also have some meds listed. Some of the popular meds will be the Halodol, which you can see that they have the different strengths that are recommended for the 1 milligram, the 2 milligram, and the frequency. And they and that another popular drug used will be the Risperidone. And I also attached this sheet that came from one of my articles for those people who aren't familiar with the signs and symptoms of the delirium. They can see the clinical features such as acute onset, the the disorganized thinking, or the lethargic or the agitation. And we also got the predisposing factors, which are the elderly, the male gender, pain, either drug or alcohol abuse. And we also had the precipitating factors, which go more with my project, which is like the surgery for those that have their hips done, or maybe they are sleep deprived, which that happens a lot in the hospital as well. And I also attached a list for some of the interventions that could be used. Um, the delirium treatment, that starts from the time that they arrive at the hospital to the time that they go to surgery. We are trying to keep them hemodynamic. We are also going to be taking the specific care to avoid areas such as the dehydration or the hypovolemia, because this can also increase the risk for the delirium or to make it